Okay, so today we will be starting with pathology, general pathology, and this is the textbook JL Vegad, a textbook of Veterinary General Pathology. Okay, so let us start. Wait a second. Okay, let us start. So, pathology. Pathology is a study of disease. This is the simplest definition which can be formed for pathology. Pathology is a study of disease. Now, pathology is the study of structure and function of body and disease. See, study of structure in normal condition is called anatomy. Study of function in normal condition is called physiology. Normal condition is called physiology. And the study of structure and function in disease condition is called pathology. Okay. Okay. Now, the subject of pathology is to acquaint the student with the changes occurring in the tissue as a result of disease. What is the meaning of this statement is that it says that pathology teaches the student, anyone who studies pathology is taught or comes to know or get to know the changes occurring in the tissues due to that disease, particular disease. Okay. Now pathology is therefore central to an understanding of disease. This point is important. To understand the disease, we should first understand the pathology of the disease. Okay. Next, this point, let us discuss this point in detail. See, disease is first produced at a molecular level, that is biochemical or molecular level. Okay, let me try to explain this point. So what this point says that, let me write it here. First, a lesion, I will explain the lesion after some time. So first here let us talk about a disease. So a disease first produced at a molecular level. Okay, first produced at a molecular level. Okay. Next is, it is then produced at the electron microscopic level. Then it is produced at the light microscopic level, and then it is produced at gross level, gross or macroscopic level. So let me explain this point. This is the point which I explained. So see, what we are able to see, for example, if an animal, or a human also, let us try to understand in our body. So if we want, for example, if any human cut its hand, or there is a cut or an injury on the surface of its hand, of its forelimb, so we are able to see the outer structure, we are able to see the gross or macroscopic level. Without any microscope, we can see that this part of the body has been injured, but the injury does not start exactly at that level, that is the gross or macroscopic level. It starts first at the molecular level, then it starts at the electron microscopic or ultra microscopic level, then it starts at the light microscopic level, and then it goes to gross or microscopic level. So then we are able to see the gross or microscopic level. Okay. Now if we talk about what is general pathology, so general pathology is concerned with the basic reaction of cell and tissues to injurious stimuli. Okay. What is general pathology? General pathology is concerned with the basic reaction, how the cells react when any injurious stimuli is when they face any injurious stimuli. What is the meaning of injurious stimuli here? Injurious stimuli means that any antigen or any factor that which is injurious to the health of the cell or tissue. Okay. Now pathology covers 5 aspects of a disease process. There are 5 aspects of a disease process: cause, pathogenesis, structure and functional changes, clinical significance, and resultant termination. Okay. So if we talk about cause, it is also called etiology. There are 2 major classes of etiological factors: genetic or intrinsic, and acquired or extrinsic. So genetic are also called predisposing or endogenous factors, and acquired or extrinsic are also called exogenous factors. Okay. Now endogenous factor are the factor on which there is no control of the particular animal or human, and extrinsic factor, that is also not under control, but in some manner we can control the extrinsic factors. For example, extrinsic factors include infectious, nutritional, chemical, physical. So we can change the nutrition, we can vary the nutrition, we can avoid going to the places or drinking infectious water. So for example, giving them to animal or pet animals. So this is the example. And the intrinsic factor, genetic or intrinsic factor, these includes the breed, sex, and these type of factors which are intrinsic, which are and strain which are not under control of any animal or human. Okay. Now genetic factors. This is a well-known fact that genetic factor affect environmentally induced diseases, and environment also affect the genetically induced diseases. Okay. Okay. Now pathogenesis. Second factor is pathogenesis. So pathogenesis is the progressive development of a disease from the time of its initiation to the time of its conclusion, that is recovery or death. Let us try to understand this statement, that pathogenesis is the progressive development of a disease process. So a disease, how the disease is initiated, first the disease will initiate, now then it will conclude, then it will progress, and then it will conclude. So conclusion can take place in three ways. They have written two, but there are three ways. So here they have written in three ways: recovery, death, or invalidism. We'll check this after some time. Okay, meaning of this recovery, death, and invalidism. So study of pathology remains pivotal to the subject of pathology. Pathogenesis, sorry, the study of pathogenesis remains pivotal to the subject of pathology. Okay, so this is easy. Next is third is structure and functional changes. So these are the morphological and associated functional alteration in cells or tissues. Okay, what is the meaning of this statement? Morphological means related to morphology of the cells or tissues, and functional alteration means the changes in the functional properties of the or functions of the cells or tissue in response to injuries. Okay, so this is the meaning of structure and function change. So these are the morphological and associated functional alteration in cells or tissues. The changes is structure and functional changes takes place in the cells or tissue due to the disease. Okay, now there is one term given here which is called lesion. Okay, which is called lesion. So lesion is the macroscopic or microscopic alteration occurring in the tissue as a result of injury. Example, fracture in a bone is a lesion. What is the meaning of lesion? Is that it is a macroscopic, that means it can be seen without the help of microscope. Lesion simply means that any injury or disease. Okay, so it is a macroscopic or microscopic alteration or change occurring in the tissue because of injury. Okay. Okay, now there is one type of lesion that is called pathognomic lesion. This one, pathognomic lesion. So it is an alteration that indicates without a doubt the cause of a particular disease. Okay, what I mean of this statement? It indicates without a doubt the cause of a particular disease. That is, if we are able to identify the pathognomic lesion, then we can identify which disease caused that lesion or what is the disease from which the animal is suffering from. For example, button-shaped ulcers of large intestine in swine fever. Okay, zebra markings of large intestine in rinderpest. Okay, punched out ulcers in the abomasum in filariasis. Okay, negri bodies in the cells of the hippocampus and cerebellum in rabies. So these are some examples of pathognomic lesion. Okay, now there is one term given here that is called symptom. Okay, so symptom is a clinical sign. Example, fever, swelling, diarrhea, vomiting, lameness, etc. manifested by the individual as a result of tissue changes. Okay. Okay. So what is the meaning of symptom? Symptom is a clinical sign. Any clinical sign which is shown by the individual because of the disease, that is called symptom. For example, fever, diarrhea, swelling, vomiting, lameness, etc. Okay. Okay. Next, fourth aspect of a disease process is clinical significance. Okay. So clinical pathology involves the use of laboratory method by clinician to help them arrive at a diagnosis. Okay. Clinical pathology involves the use of laboratory method by clinician to help them arriving at a diagnosis. It includes the examination of blood, urine, feces, exudate, skin scraping, biopsy, and material. Okay. Okay. So what is the meaning of this statement? Clinical pathology involves the use of laboratory method. Okay, laboratory method by clinician to help them arriving at a diagnosis. Clinicians or doctors use the laboratory method to help them arrive at a diagnosis. It includes the examination of blood, urine, feces, exudates, skin scraping, and biopsy material. I forgot to check the meaning of exudates, so I will check it and tell in the next lecture. Okay. Now, what is the meaning of diagnosis? It is the art or act of identifying a disease from a sign or symptom, and also through various laboratory tests. Simple. Prognosis is the chances of recovery. Prognosis is the chances of recovery. Prognosis is the chances of recovery. Okay. Okay. Next is result or termination. So Now, result of termination, it occurs in three ways. See how a disease is progress. First, disease will initiate, then it will progress, then it will terminate or conclude. So it will conclude in three ways: recovery, death, and invalidism. Okay, what is the meaning of recovery? That if the disease has done damage to the body of the animal, but it is not that much that it will kill the animal, then it will lead to recovery of the animal. Death of the animal means that the disease has done so much damage to the animal that the body of the animal will not be able to recover itself. Okay. And invalidism means the disease has caused damage, but it is not that much to kill the animal and not that much to cure the animal, not that much that the animal can recover from. Okay, so that is called invalidism. Invalidism occurs in Jones disease and tuberculosis in cattle. Okay. So next we will cover in next lecture. Thank you.